My name is Melisa Winterhalter. I'm a physical therapist and the facility manager of the ATHLETICO Displays Clinic. ATHLETICO Physical Therapy was established in 1991. We started with one clinic in Chicago, and we've since expanded to over 500 clinics in 12 states. And the Displays location opened in 2008. Physical therapists are movement specialists, so our role is to help with movement disorders, any pain that you're having or difficulty doing things throughout your day. Physical therapists are the profession that can help you get back to your goals. ATHLETICO Displays provides physical therapy across all age ranges. So we see pediatric patients, we see adults, weekend warriors, we see student athletes, we also see older adults as well. Some patients come in after they've been injured in a car accident or a work-related injury. We see a lot of patients post-operatively, so once they've had surgery and need some help with their rehabilitation after that, we help patients to restore their range of motion and restore their strength and get back to walking and doing the things that they like to do. We see a wide variety of specialized conditions. We see vestibular therapy, which is patients with balance and vertigo disorders. We see patients who have had very specific sports injuries, and we customize their treatment plan to help get them back on the field or back on the mat and help them get back to what they love doing. When a patient arrives at the clinic for their first visit, we bring them back into a private treatment room and we spend 60 minutes one-on-one with the patient. A very important part of physical therapy is interviewing the patient and learning more about what got them here, what hurts, what have they been struggling with, and what are they trying to get back to, what are their goals. So we spend a lot of time talking to that patient about what they'd like to get back to, and then we do a lot of examination with them, so a lot of measurements, a lot of testing of a patient's mobility and their strength, and then we get started right away on a treatment plan. We start with a hands-on component, so some manual therapy with the patient, and then we also work through exercises with the patient as well. We teach them how to do the exercises in the clinic, and we supervise them doing the exercises to make sure they're doing them correctly, and then we send them home with a home exercise program so that they continue practicing these exercises on their own. And then each time they come back for physical therapy, we reevaluate how the patient is doing, and then we update their exercises depending on how they're feeling. We see patients for following a total joint replacement, and so when they come for physical therapy following a total joint replacement, they may need help bending their knee again if they had their knee replaced, and so the therapist will work and do some hands-on techniques to help them bend their knee again, and then teach them some exercises to continue working on bending and straightening the knee. They might work through some different ways to walk, different ways to balance, and different ways to improve their strength as they're going through their rehab program. We also have patients who have dealt with chronic pain for some time, and so they come in here after they've been experiencing pain for a good amount of time, and they come in here looking for strategies to how to decrease their pain. And so with that, there's a lot of education, a lot of teaching them how to move better, working on body mechanics, whether that's lifting, whether that's just kind of protecting their joints, and also doing different exercises to get them moving and get them stronger again. We have patients that come in that are on crutches and they need to learn how to walk again. We have older adults that have some balance and walking difficulties, and so we teach them how to walk as well. We also see some younger student athletes, and so when they get injured on the field, they come here for their rehab to help them get back to their sport. As a healthcare facility, we follow the CDC guidelines for healthcare providers, so we're always staying up to the latest guidance with that. We have every patient sanitize their hands when they walk in, and we also sanitize all of our equipment in between uses. We sanitize our treatment tables and all of our exercise equipment. We also have a nice large facility, so we are able to space patients out away from each other when they are coming here for physical therapy. So some patients get to us with a prescription. So some patients will go see the doctor first and they will recommend physical therapy, and then you can come and schedule an appointment with us. Other patients get here without a prescription, and most insurances do allow physical therapy without a prescription, and so that allows the patient to get in as quickly as possible to start their rehab program. And so research has found that the quicker you can get in following an injury, the better your results and the better your outcomes when you do have pain. So for example, if you wake up one morning and you're experiencing back pain, give us a call. We can help to decrease your back pain with that. Or if you have some chronic pain that you're not sure where to go, try a physical therapist and see what we can do to help you out. So we've been proud members of the Des Plaines Chamber of Commerce since we opened, and we love participating in their events and interacting with the Chamber. We've had a couple of events at our clinic with Chamber members, and we were very appreciative during COVID. The Chamber did a great job of getting emails out and just updating us on the latest information that was coming out regarding any COVID-related concerns. And we just love being part of the Des Plaines community. The biggest compliment our patients can give us is when they send us their family members, when they send us their neighbors or their coworkers, that hopefully we're the preferred provider for physical therapy in the Des Plaines area. We're ATHLETICO Physical Therapy in Des Plaines, located at 1479 Lee Street between Oakton and Algonquin. Phone number is 847-299-7470, or visit us at athletico.com. Please stop here!